Hi, I'm Dr. Nitu Bajekal, and I'm a consultant gynecologist and a women's health expert since 35 years. Today, I'm going to answer your most frequently asked questions for TOTM for their new series content called The Drop. Let us discuss vaginal discharge. Vaginal discharge is normal. It is a fluid or mucus that lubricates the vagina, that keeps the vagina moist and prevents infection and keeps it clean. It's really important to avoid using feminine wipes and feminine washes and harsh chemicals in that area, as they strip the vagina of the good, healthy bacteria that protect the vagina from infections. So it's really important that you are aware that vaginal discharge can change in consistency, in texture, in color throughout the menstrual cycle, as well as you get older. It also depends whether you're having a natural menstrual cycle or whether the cycle is affected by hormones that you may be taking, such as the pill or a coil, as you may notice changes in the type of discharge. Now, discharge is usually clear and slippery and egg white around ovulation, and this is a sign that you are ovulating. Sometimes it might be a little bit blood tinged, and this excessive slippery discharge is to allow the sperm to penetrate the cervical mucus and fertilize the egg. You may notice that the vaginal discharge is quite thick and sticky just before or just after a period. If you notice that there is curdy white discharge and itchy discharge, your discharge has a smell that is persistent or is offensive, and the most important is that if you have persistent blood-stained discharge, even if you've had a recent cervical smear, please do not ignore it. You must seek medical advice. If you notice that your discharge is profuse or gray or green or has changed in its nature quite significantly, and that you are at risk of being exposed to a sexually transmitted infection, it's very important that you seek help from your doctor so that you can have swabs and be treated early for any sexually transmitted infection, as delay can have problems with pelvic pain and infertility. So I hope I've helped you understand that vaginal discharge is normal, especially between the ages of puberty and menopause, although it can occur at any time. But if you notice changes, seek medical advice and do not ignore it. Pregnancy as well can increase vaginal discharge, or if you've had surgery to the cervix, you may notice a blood-stained discharge for a few weeks. But at any other time, blood-stained discharge should not be overlooked and should not be ignored, and you must seek medical advice. If you have any further questions, do drop them in the comments below. Otherwise, you can follow me on my Instagram page at Dr. Nitu Bajekal, where I answer questions like this all the time. And I have my website, www.nitubajekal.com, where again, I've been addressing all these questions that women often have about women's health.